Hello. Good afternoon, fellow friends and loved ones. It's once again a very blessed day, the 22nd of September. It's a Wednesday, yes, and we are coming to you, your homes, your workplaces, your houses, wherever you are, in the bus, going home. And want to thank you. Let me thank you for your time, for joining us in another wonderful health discussion. Yes, we've had a series of discussions in the previous weeks, various health discussions, and I'm sure today will not be an exception. Yes, and so we want to keep our ears attentive and we want to keep our fingers crossed as we delve into a very important topic for today. I'm sure you enjoy it, and before we start the presentation, we want to begin it in the name of the Father and the Son and the Holy Spirit. And thank you very much for a calm afternoon. The weather is very calm and the first and foremost, we want to appreciate in fact, every single person, every single personality. First of all, I want to thank God for giving us this honor, a very great privilege to take this award. Yes, it hasn't been easy. But by the grace of God, we're able to annex this prestigious award. Yes, so before we end, we'll show you the award. It's actually a privilege. It's a privilege. We are humbled to achieve this. And so let's discuss today's topic, and then when we finish, we'll climax it with this award. Thank you very much. So we're talking about a topic called COVID-19. COVID-19. I'm sure you've heard about COVID-19 for the past getting to 2 years, or if my memory serves me right. Yes, it's this whole pandemic started in December, yes, 2019. Yes, it was declared by the World Health Organization on 2019, December 2019, 31st of December. WHO, that's the World Health Organization, declared COVID-19 as a pandemic. They said it originated from Wuhan, China, and so they found out so many ways and how it was able to transmit from an animal to a human being, and then how many people were affected, and so many things went on before it was declared as a pandemic. And so in February in 2020, about 67 million people were confirmed as having cases of coronavirus, and this was really on a high. And in the same February 2020, it was declared that about more than a million persons had passed on due to this condition called coronavirus. So it had to be taken very serious because we couldn't lose more people into deaths as a result of this condition, which can be prevented. And so many things are taken into consideration. So we're talking about COVID-19 right now, this afternoon. So what is COVID-19? So COVID-19 is actually a name coined from a word called COVID and 19. So COVID is actually coronavirus, and the 19 is as a result of the fact that it was discovered in 2019 December. So that's why it was combined to form COVID-19. Coronavirus is actually one of the viruses that we have. We have so many viruses that exist in the air, in the atmosphere, which I'm sure a very common one is a common cold. So if you have cold, it's as a result of transmission through a mechanism called the viral transmission. And so if I have cold and I'm sitting beside you, the chance of you having cold is high. That is relative to your immune system. So if you have a low immune system, you don't really eat well, you are likely to have your immune system exposed, and therefore the cold or the virus can attack your immune system. So similar to the coronavirus also, we have similar characteristics. But the fact that they all transmit through this similar method risk the fact that you can have coronavirus through the same medium, that's through air. So in terms of your genes, that is where we have everyone has different genetic makeup. Coronavirus also is specially made, and so it's transmitted a bit different, though it goes through the body through the airway, that is through your nose or through your mouth. And so we're talking about coronavirus today. So we've talked about what coronavirus is. So actually, corona means it's a Latin word, corona. It means crown. So the fact that when you look at the corona um, virus, its indication, you can see that it looks in the form of a crown. So I'm sure after the presentation you'll see a picture of the coronavirus on our Facebook wall, and you'll be able to appreciate it. So you can log into our Facebook wall and you see a picture of the coronavirus. Yes, how it looks like, the crown nature of that structure. It's a gene structure, which is very difficult to be able to break its transmission because of the fact that it can change itself in so many virus forms. And so that's why we are having difficulty in terms of solving the issue of bringing the coronavirus into arrest, that is stopping the transmission totally. So you can just have a few people being treated, but then the fact that it can replicate itself shows that it can change its form at any point in time. So before the coronavirus was identified, they had other viruses, such as the flu virus, that's the one that causes the cold, rhinovirus, and so that causes the cold. And so scientists actually went to China, that is called Wuhan, to find out exactly why and how this it is caused. Before the coronavirus was discovered, we have a similar or a known one called the SARS-CoV virus, and this actually was transmitted through cats to human beings. So we couldn't be able to originate where exactly this new virus called the coronavirus. So it was discovered as new novel coronavirus. So they didn't really know how it was transmitted. The cat one, it was known, but this was quite strange. So scientists are actually still finding out how to really eradicate this condition called the coronavirus. There are so many medication, there are so many drugs that have come out. I'm sure we've heard about the AstraZeneca, we've heard about the Johnson and Johnson's vaccination drugs, and so there are still some medication to help to minimize the rate of infection, that is to be able to reduce the level of or the extent of transmission of this virus. And so if you're able to cut or break the cycle, then you're able to stop or eradicate this condition. But then this virus is very stubborn, so it's able to duplicate itself and then change itself a little. So then if you're using this medication for that, the next one is able to withstand it. And so scientists are doing their best to be able to take this condition called coronavirus out of town, is even out of the world. And so there are so many signs and symptoms of this condition. I'm sure through media outlets, through various radio presentations, you've heard that this condition is transmitted through the nose, and you cough a lot. You begin to cough a lot when you have this condition called coronavirus. You cough a lot. You're unable to breathe well. These are all clinical symptoms, and they could be mild, they could be moderate, they could be very severe. But most of the cases, coronavirus patients or coronavirus symptoms are mild. So where you have slight cough with slight difficulty in breathing, you rest a little, your immune system comes up, and you're able to fight this virus. The condition is actually able to overcome you when your immune system, you have soldiers in your body, and we have, we call the lymphocytes, we have white blood cells and other structures in your body that's able to detect the presence of foreign bodies in your system. So when these bodies are very active and then they are strong, when you have this virus entering your system, they're able to catch them and then destroy them. When the case of your immune system is low, they are not so strong, they're able to fight your immune system, and then you don't survive. Either you become unconscious, you go through coma, you go through so many discomforts, and then you pass on. But then if you have a strong immune system, you're able to take in good food, you're able to stay away from um, 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 persons who are showing symptoms, and also keep a good hygiene. We'll be talking about various ways of preventing it very, very soon. And so it's very important that some of the symptoms include fever. So that's why I'm sure most institutions, you see that they will having a gun thermometer. They'll you look at your face and they can tell whether it's 36.5, 37, 38. And so if your temperature is high, the normal temperature of every human being is 37 degrees Celsius. If you see that it's 37 degrees Celsius, it means your temperature is very normal. It can be 36.5, it can be 36, it can be 35.9, 38, no, 35.9, 35.8, yes. But when it rises up to 38 degrees Celsius, 39, it means you're getting to fever. Fever is about 39 degrees Celsius or 40 degrees Celsius. In fact, when it comes like that, your system becomes so hot, you become restless, and there are so many discomforts in terms of having a fever or having fever. And then also there's cough. It could be persistent, it could be just normal cough, but it will be constant. And so it could have, as we said, shortness of breath and breathing difficulty. And then also you feel tired easily, because this, as we said initially, when there is overload of your system, that's when the virus enters your system. It goes to shut out many parts of your many organs, and then it doesn't enable you to function very, very effectively. So you feel tired. Any small thing you do, you get tired, and you become breathless. And also you have sore tooth. So these are all clinical symptoms. You could have sore tooth, it could mean that you have cold. But then other investigations, when you bring or you report your symptoms as early as possible to the medical doctor, he's able to detect whether it's actually the virus or the cold virus. So we realize that, as we said initially, few people show severe symptoms, and that is when it becomes so severe that the person can't do anything. But majority of the cases indicate that we have mild symptoms, that is some cough, some sore tooth, general sore tooth. So when you're taking medications, the immune system is able to fight it off. If you're taking fruits also, the immune system is able to upgrade itself, and then it's able to fight off this low grade viruses. But then when none of them is taken into consideration, and you say I'm managing, I'm just drinking water, if you don't take care, the soldiers, that is the coronavirus, just could attack your organs, and it could render you bedridden. So other symptoms also, that is emergency indicated, is when you have difficulty or shortness of breath. So you can't breathe well and you're struggling to take in breath. And let's take note that the coronavirus is actually attacks the respiratory system. When we say respiratory system, it comprises of mainly your lungs and your pharynx. And then you'll have something we call the bronchos, trachea, and your lungs. These are very important structures that the coronavirus attacks, because it's able to narrow or constrict the vessels or the air passageway of the air into your lungs. So if it's able to narrow it, it can cause distraction to your lungs. It could collapse your lungs. You have something we call atelectasis, that's collapsing of your lungs. So in the case where the virus enters through your nostrils, which is able to replicate itself, it's a very good habitat. The virus is able to survive in your nostrils, able to survive in your pharynx, and then your lungs for quite a longer time. If your immune system is not so strong, it can be able to overtake it and then collapse your lungs. It can cause shortness of breath. It can cause, actually, even to the extreme of death. Yes, so as we're talking about, um, the symptoms of the coronavirus, yes, we have the breathing difficulty. You could have sore throat. That is where we have sore throat, and then also shortness of breath. And then in the case we could have confusion. That is when you're not able to think well. Yes, and then some of the symptoms include blueness, that is in the face. So you could have a bluish lips, and then also your face could become bluish. This is because there's poor blood supply and then poor oxygen. So in the case where you have poor oxygen supply because you're not able to breathe well, oxygen is not able to enter your lungs. And then if oxygen is able to enter the lungs, there'll be poor blood supply containing oxygen into your body system, into your organs. So blood that doesn't have oxygen looks bluish, and blood that have oxygen looks less bluish. And so that we call it cyanosis, where you have bluish fingers or bluish palm, and called cyanosis. And so people who are of high risk, that is people who are likely to be affected by this condition called coronavirus, are people who are 70 years and above. This is because it is rather that they have a weaker immune system as compared to a very active person who has his organs good, functioning well, and then he has a good immune system. So it's noted that a younger person will have a less chance of having the coronavirus. But then other complications including diabetes, including the cardiovascular disease, heart disease, and chronic respiratory disease. We could have bronchitis, we could have bronchiectasis, and then someone having a cancer also could predispose the person to having coronavirus, because in that case the immune system has been compromised. So the virus can attack the immune system, replicate itself, change itself as many times, and deceive the immune system as a conducive host, and therefore attack the immune system. And therefore, when this happens, the signs can be showing as we said initially. You could have shortness of breath, you could have fever, you could have difficulty breathing, bluish lips, and so many. And then fatigue, very important, fatigue. You could have also hypertension. If you have hypertension also, you could have the coronavirus. You are a risk factor of having coronavirus. It means that you would have coronavirus. Other factors also could have you have coronavirus when you have close contact with the person who has symptoms or who has the virus within him or herself. That's why we advise persons to wear a nose mask, keep at least a meter distance between each other. Yes. So we have also other conditions that we call chronic liver disease. So in the case where we have the liver being either destroyed, we have so many stages. We have first, second stage, fourth stage of liver conditions. And so if you have a chronic liver disease, it could also have it could be a risk factor of having this condition called coronavirus. So it's advised by the World Health Organization that anyone who has this condition, or anyone, even when you're conversing, you can't tell whether the person or the next person has coronavirus. So it's advised that if you're communicating, you should be 1 meter apart. So 1 meter apart, and then also you have to wear a nose mask. If you want to shake, avoid shaking. Don't even think of shaking a person. You can just give a person like a blow like this, as a greeting, or you can wave. So if you want to communicate to someone, don't get close to the person. I'm sure you'll be wondering, if you have a child in the house, what should you do? Yes, so that's why we have personal hygiene. When you're home, you wash your hands, you make sure your clothes are clean, and you make sure that your children's items are clean. They don't expose them. So when they come back from school, they wash their hands, they change their clothes, they wash down as best as possible, and also they disinfect areas in your house as constantly as possible. This is mostly when you have visitors who are coming in and going out. So you are taking consideration where you have a washing bay or washing these Veronica buckets that we've had. You can have them outside. You can have a sanitizer just at your doorstep. When someone enters, just sanitize their hand and then enters. So it's very important that we take note of these guidelines that will help a lot. You avoid touching and using of sanitizer as constant as possible. And so, how do we treat this condition as coronavirus? First of all, we want to make this clear indication that coronavirus has not had a cure. We've not discovered a cure for coronavirus. Now, there are so many preventive measures that is giving your immune system a boost to be able to resist any attack or any attack by this virus called the coronavirus. So the fact is, there has been so many medications to increase the immune system. So you have the Johnson & Johnson, you have the AstraZeneca, we have some more that are coming up, and to be able to fight this condition called the coronavirus. There have been so many literature reviews that showing that yes, they are all very good, and we can see some reduction in terms of the coronavirus cases, especially in parts of the world. Though various safety measures are still on a low key, and that at least we are doing well. We're not doing bad, but we need to take more cautions in terms of our communication, our nose mask wearing. And so it's advised that anywhere you are going, if they are in an open space where there are no people there, you can take off your mask. But in the case where you are in a vehicle or in a transport, you need to wear your nose mask. You need to also sanitize yourself, sanitize your hands very often, and also try and keep a distance apart when you're communicating, and not communicate directly with the person facing you. So, and also, if you show signs and symptoms of fever, if you don't feel well, you need to report to the doctor as early as possible so that we can have a treatment very early. Because when the symptoms are mild, the treatment is very effective and highly effective. So how do we find out whether someone has coronavirus? Aside the symptoms also, we could also take if the symptoms are very severe, you can take an X-ray to see whether your lungs are very fine. You have reduction of air spaces. If your lungs are fine. But if you have the air spaces being reduced, then they are likely indicators of you having the condition we call, or the virus we call the coronavirus. Yes. So we will put it into 3 categories: mild, moderate, and severe. As we mentioned earlier on, the mild, there's something that can go away with time. The fact that your immune system is very low. The moderate is where we have showing signs of symptoms as coughing, restlessness, fatigue, and then the severe one is where you're in the respiratory distress. You can't breathe, very little access to oxygen into your system. Because you can't even walk. You become restless. Yes, and so these symptoms actually doesn't come all of a sudden. It would be a day, 2, 3 days, a week, 2 weeks, even a month. Yes, and so this cough could be also because something productive cough and non-productive cough. But then, if you have a productive cough where you have, by lab test, you have sputum inside, you can take and see whether you have coronavirus. The virus is indicated inside. There are so many ways you can take it through the nostrils. So most lab scientists take it through the nostrils, and then you swipe through the nostrils to be able to send to the lab and detect whether we have these coronaviruses inside. So when it's noted that you have it, even for the mild cases, we take into quarantine. We call something quarantine, either in the home or in the quarantine day. If it's mild, I'm sure we noticed in the past few months that some people were quarantined in their homes and they didn't go out. They were restricted. Some people were, in severe cases, were sent to the Gan East hospital, where they were confined and they were treated. Some were discharged, and some also they took medication. They were also taking fruits, and then they were able to recover very effectively. So through a chest X-ray, as we said initially, we can see whether the lungs are fine, if there's any airway reduction space, yes, we could detect this condition as coronavirus. So if your airway has been narrowed, it's an indicative factor that you have coronavirus. There has been so many instances, not maybe in Africa but outside Africa, where so doctors, surgeons have been able to detect it through these X-rays, and has been easier through also lab tests to be able to treat this condition as early as possible. Okay, so there are other viruses that, as we mentioned earlier on, look like coronavirus. And then we have something like the influenza. I'm sure you heard about it before. Influenza. We have adenovirus. We have the human pneumovirus. We have the parainfluenza. We have the respiratory syncytial virus. We have the rhinovirus that causes the common cold, the rhinovirus. And we have bacterial pneumonia, mycoplasma pneumonia, so many ones that could present itself with symptoms that look like coronavirus, but through lab tests, through X-rays, through especially lab tests, we can able to detect whether it's the coronavirus or not, because it's genetically indicated. It's through lab tests that we can detect whether it's coronavirus. Remember that as we had this pandemic on a high, we had medical laboratory scientists going from home to home to take the swabs of people who have this likely indications of having one of the family members or the persons in the home having coronavirus. And this was to help to curb the rate of transmission of this condition called coronavirus. So how do you treat it? So we mentioned our main topic was the role of the physiotherapist. For the medical practitioners also have their ways of treating coronavirus, medication. The nurses also have the way of following and giving them the patient medications. But the role of physiotherapist actually is to increase airway and also to improve function of other body parts which has been immobilized, and also to be able to increase circulation and also return function to various parts of the body that has lost its ability, and also to be able to live an independent life. That is the ultimate aim of the physiotherapist, the management of COVID-19. So if the person has a is in respiratory distress, we have the doctor comes in to be able to stabilize it so that you can have oxygen, that is artificial oxygen, being given to the patient. But in the case where the breathing difficulty is quite not severe, we have a device called the incentives parameter. That is where the patient takes in so as he or she sucks in the breath, is able to open up the lungs for the lung to regain its elasticity. Again, that is the ability of the lung to expand and contract very, very, very well. The physiotherapist goes in and uses the incentives parameter. We have also respiratory procedures. We have the vibrations. We have the positioning. We have the percussions, where we is able to improve the lung function. Also, if there's any fluid in the lungs that is obstructing the airway from normal functions, so respiratory therapy is done for the patients. So we also encourage active breathing. So if the patient is having difficulty breathing, you actively breathe. So close the mouth and open. So the patient closes the mouth like this and opens up. So as often as possible helps also to actively open up the airway for the patient to breathe again. And also very important, the dietitian also encourages healthy diet to also enhance the immune system's ability to fight infections. So the physiotherapist also encourages active exercises. So in the case where the condition is mild or moderate, where the patient is able to walk and is able to walk at least a shorter distance, we encourage gradual walking distances. That is, if you can walk a meter, the next day walks about 2 meters. And so we encourage graded walking exercises and other exercises that the physiotherapist also goes through with the patient to be able to enhance function and also get independent. Yes. So aside that, we have so many exercises. Yeah, so many exercises. We have from normal exercises to moderate exercises to intense exercises. That is all aimed at getting the patient to be independent and functionally accessible. Okay, we have supportive therapy, we have respiratory exercises that we go to the patient. In the case where the patient has is the condition is very severe, the patient is sent to the ICU, and we go through various um, respiratory techniques to be able to get the patient's breathing very normalized. Okay, so let's look at some pictures to show us what exactly the condition looks like. Okay, okay. So yes, let's look at the pictures now. Okay, so just a minute. Okay. Um. Okay, so just a minute. It looks like we have to. Okay, so that some of the pictures that will be following up very soon, in terms of the condition we call coronavirus. Um. I'm sure we'll be anxiously waiting to see the pictures. Don't worry, just a minute. Just a minute. Okay. Okay, so thank God, yes. Look at the pictures. Um, okay, so sorry for the delay. So these are the pictures. You can see right here the physiotherapist going through some exercise program with the patient. Yes, I'm sure you can see him trying to raise the hands up. The patient is on this tube is called the NG tube, the nostril um gastrointestinal tube, to be able to enable feeding where the patient is able to feed well. You can see this is also a tracheostomy tube. This is called a tracheostomy tube um to the neck region to be able to enhance airway breathing to right into the lungs. Okay, so you can see these are the physiotherapists trying to increase the function of the hand and maintaining the strength of the hand to be able to also allow the heart to function very well. So with less activity, the heart doesn't function well. So with increased activity, enables the heart to function well, and also enables the oxygen to be efficiently used. And then, in a normal or in a general perspective, the patient is able to return to function as best as possible. Okay, so this is also a physiotherapist trying to get the patient active. That is where in the moderate state. So this is where the patient is very severe in the case. So we can see the physiotherapist trying to change the position of the patient. So these are a lot of physiotherapists trying to change the position of the patient. So these are people who are wearing masks. So you can see them, they're wearing masks to be able to prevent themselves. This is actually a picture. This is also a physiotherapist trying to get the patient to actively breathe. So this is called the mask, the facial mask, the nose mask. So this structure is actually a tube where it's connected to the oxygen chamber, so that it allows the patient to breathe as assisted. So the physiotherapist has taken the face mask or nose mask off the patient's nose and is trying to tell the patient to breathe in and out, to breathe in and out, to be able to get the patient's lungs functioning very, very well. Also, you can see this is also the medical doctor trying to see whether the heart is functioning very well, or the lungs are functioning very well. This is actually an indicative of the unity in terms of a collaborative approach. That is where we have the multidisciplinary team coming together. We have physiotherapists, we have doctors, we have dietitians, we have counselors, we have psychologists, we have nutritionists. We have so many people coming together to be able to treat coronavirus cases. So this is the physiotherapist also trying to train the person that is with weak arms. So the coronavirus could attack the lungs and could cause poor circulation. It could cause weakness in some parts of the body, such as the arms. So this is where, with activity, it helps to also improve circulation and strength. So this is actually a flyer from the World Health Organization about the severity of the condition called the coronavirus. This is actually a physiotherapist trying to get the patient to stand and to walk again. So this is also another one here, trying to stand the patient and get strength into their legs. Yes, so you can see here, this is also a physiotherapist trying to ask patients questions how they feel. So as we said, it affects actually the chest region, that's the lungs region. So this is also a picture. You can see this actually in India, and they're trying to talk about the coronavirus and the fact that physiotherapists also play a role in terms of management of COVID-19 patients. Another flyer in terms of exercises. So we have some exercises that the patients go through, that sit to stand exercises. We have the marching on the spot, we have step up exercises, we have walking, heel raises, toe raises, one leg stand, wall push off. These are some basic exercises that the physiotherapist will go through with the patients. So the main aim is actually to improve the fitness, to reduce breathlessness, to increase the muscle strength, to improve balance and coordination, to improve thinking, to reduce stress, and to increase confidence, and also improve the energy of the patients. So these are some of the same things that the patients could, because the patient looks, this indicates that the patient has aches. So, but the patient can also have body aches. The whole body aches and feels restless, and also feels very tired, and then he feels the heart beating unevenly. Okay, so these are physiotherapists who are on duty trying to manage this condition called coronavirus. So these are not physiotherapists trying to work with the patient with a Zimmer frame. You can see him there. So he's wearing the PPE, the protective equipment, yes, to be able to reduce the transmission rate, because this condition actually is airborne, and it's transmitted through droplets. So if there's contact with the patient, the therapist could be affected. So this is actually a gown, an overall that the therapist wears before seeing a patient with COVID-19. Okay, so this is actually an exercise that a physiotherapist also goes through with the patient just to improve the strength in the leg. Okay, so these are some of the symptoms of the patient. Okay, so if you have coronavirus, you should be able to report. You're supposed to report to the hospital as early as possible, showing the symptoms of the fever, as we mentioned earlier, fever, fatigue, breathlessness. And so caution to prevent this condition from spreading or being affected by this condition is that you should stay at home when you are sick. If you are not feeling well, stay at home. You avoid handshaking. You should also get enough sleep and eat well-balanced diet. You should also wash your hands as often as possible. Use dry your hands with a clean towel, and also avoid touching your eyes or nose or mouth. So when you're coughing, you need to cover your mouth with a towel or handkerchief. And also, we should use sanitizers as often as possible to disinfect your hands. And also, you should call before visiting a doctor. So these are some of the indicators for someone having coronavirus. This is how the virus looks like. It looks like a crown. This is how it looks like. So it has this is a virus and it has crowns on top. So you can see them there. Yes. So this is actually the severity of the condition, as severe as possible. Some people can be able to walk. Some people also remain in the intensive care unit and they are managed and they recover. Also, these are the physiotherapists trying to strengthen the patient by getting the patient to perform activity and also get the patient to breathe in very well. So this is also another one. So you're getting the patient, you're taking the nose mask from the patient to be able to do some breathing exercises and then put on well. So this was our topic for today. Our flyer for today. So this was a physiotherapist trying to get the hand function very well. Some of them, because of the poor circulation, they get paralysis of either of the limbs. So the physiotherapist, that's passive mobilization and then strengthening exercises passively to get the function maintained. This is another one, physiotherapist. This is another function of physiotherapist doing some airway exercises, respiratory exercises. Okay. So I'm sure yes, we've learned really a lot. We've learned a lot. I'm sure you'll be in the best position to say that yes, we've had enough discussion, and so yes, before we end this presentation, we want to just show us our award. This is our plaque that we're giving. I'm sure we can read it. If you can, yes, we can read it. Yes. So the foundation was awarded. That was on Saturday. A prestigious award, a global award by the Humanitarian Global Awards Committee for the best SDG 3, the Sustainable Development Goal 3 Advocate of the Year, that states of good health and well-being. So our aim actually is education. Our theme, the foundation's theme is education empowerment with focus. So we awarded this. So if you go onto our Facebook wall, we'll see some pictures indicating what we have, the program we had on the Saturday. Thank you very much for your time. Thank you very much for praying for us, for supporting us, for giving us all the necessary support, by financially, by spiritually, by physically, and everything. We want to say God bless you, and God bless you. May the good Lord strengthen you. May the good Lord take care of you and bless you immensely. And we say we are going to give you more education. We are going to support and give back to society as best as possible. We're going to do better and help a larger proportion of society. And also, if you want to support us, also you can just say a hi to us on the Facebook, or our lines are on the Facebook page. You can also make contact with us, and we can together help to make society a very great place to live in, and we can help and impact the society. You're all welcome to our organization, and we want a good support even as we enter into our third year. So we're in our third year of existence, and want for us all to appreciate this. I mean, 3 is grace. The number 3 is grace. So we pray that the grace of God takes us through to a higher level in the name of the Lord Jesus. Wants to take us to a higher level. And also, this coming December, we're having another wonderful screening at the Tema station, and I'm sure we've seen the flyers around. And so let's support this worthy cause. We'll be having other events coming up before that grand event that is on the Christmas day. Let's stay tuned and let's keep on to our Facebook, or we'll pass on any information that we'll be doing or that we're carrying out in the course of time. Thank you very much. Have a blessed day. We win it together. Take care. Goodbye. Okay, so want to see thank you very much for those passing by. Richard, I saw Chris, I saw many others coming and going out. May the good Lord be with us all. So the next presentation will be sent on our platform very soon. So just stay tuned and goodbye. Have a blessed evening.